Most colon cancers happen randomly, but about 1 in 10 are inherited, and these are through gene mutations that can run in families. This includes the Lynch syndrome, FAP or Familial Adenomatous Polyposis, and other conditions dramatically rise colon cancer risk. Today, we'll break down the genetics, inheritance, and prevention and other cancers linked to this syndrome. The most common inherited cause of colon cancer is Lynch syndrome, also known as hereditary non-polyposis colorectal cancer. It is caused by a mutation in a mismatch repair gene. The risk of colon cancer goes up to 50 to 80% in your lifetime. The average cancer diagnosis occurs at the age of 40 to 50s, much earlier than the general population. Cancers tend to occur on the right side of the colon. But it's not just colon cancer. Lynch syndrome also increases the risk of endometrial, ovarian, gastric, urinary tract, and certain skin cancers. The next genetic syndrome is actually FAP, or familial adenomatous polyposis, another major syndrome. It is caused by a mutation in the APC gene. These patients develop hundreds of thousands of polyps in their colon, often starting as a teenager. Most colon cancers are nearly 100% by age 40 if the colon is not removed. Also, it's linked to duodenal, thyroid, and other cancers. For FAP patients, surgery to remove the colon is usually recommended before cancer develops. Other genetic syndromes, well, two other important things but less common are the MUTYH-associated MAP polyposis, caused by the MUTYH mutation. The risk for colon cancer is 70 to 80%. Unlike FAP, it's inherited recessively, meaning both copies of the gene must be mutated. The next one is going to be the Peach-Jagger, which is an STK11 gene mutation. This causes polyps and increases risk of colon, pancreatic, and other cancers as well. Juvenile polyposis is related to SMAD4, BMPR1A mutations, which also raises risk of colon and gastric cancer. Each of the syndromes carries unique screening and management strategies. This condition are typically inherited in autosomal dominant way. If you carry the mutation, each child has a 50% chance of inheriting it. The exception is MUTYH-associated polyposis. Both parents must be carriers for a child to be affected. That's why genetic counseling and family screening are so important. What can people do with these mutations? Well, for Lynch syndrome, colonoscopy is performed every 1 to 2 years, starting in the 20s, with consideration of hysterectomy and oophorectomy for women after childbearing. For FAP, yearly sigmoidoscopy or colonoscopy from early teens, with colectomy once polyps develop. MAP and others, colonoscopy every 1 to 2 years in the young adulthood is also recommended. Preventative surgery, chemoprevention like aspirin and Lynch syndrome, and close follow-up can actually dramatically reduce cancer risk. Living with a genetic cancer syndrome can be challenging, but knowledge is power. With early screening and proactive care, many patients live long, full lives. The key is not just protecting the patient, but protecting the family. Because if one person tests positive, their siblings and children may also be at risk. To recap, about 5 to 10% of colon cancers are inherited, mainly through Lynch syndrome and FAP. These syndromes carry high risk, but also give us a chance to act early with screening and prevention. If you guys found this video helpful, please click the like and subscribe button and type your comments in the chat. And look at our other videos that we have, and I'll see you guys next time.